Introducing, thanks, Lauren. This is our first presentation for the President's Student Leadership Institute, PSLI, at UMB. This is the first presentation for the new Global Leadership Pathway that we're so excited to introduce. And we have several other presentations coming up throughout the year, I think 8 more, and they are open to students who are part of the PSLI program, but really open to anyone on campus. And for now, we're going to go ahead with the virtual, doing it virtually, but hopefully as time moves on, we can move to in person. Let's hope for that one day soon. So today I'm going to be talking about ethical global engagement and the problem with voluntourism. But before that, I should introduce myself. I'm Virginia Rowthorn. I'm the Assistant Vice President for Global Engagement here at the UMB Center for Global Engagement. And if you haven't been to our center, we're on the 3rd floor of the Student Campus Center. So above the Starbucks on the 1st floor and below the swimming pool that is on the 4th floor. So you're welcome to come drop by and see us anytime. We're on the 3rd floor. And as you can see by those initials after my name, I'm a lawyer by training. And this presentation is going to relate to legal aspects of voluntourism. So before that, though, hold on, let me just swip this down. These are the upcoming sessions. The nearest upcoming sessions for PSLI. On October 26th, Amy Ramirez is going to be leading a session called Leading a Diverse Global Staff. She's the director of the Office of International Services at the Center for Global Engagement. On November 4th, Dr. Carlos Fayron Guzman, who's the assistant professor at UMB Graduate School and director of their global health programs, is going to be talking about decolonizing global health. And then on November 16th, Dr. Jolie Olson, who used to be at our School of Social Work and is now a senior fellow at the center, she was the director of the Peace Corps in the previous administration. And she is going to be presenting a very interesting talk on November 16th about what happened when COVID hit and they had to evacuate 7,000 volunteers in 5 days. So that'll be an interesting presentation. So now, without further ado, I am going to talk to you today about voluntourism, medical missions, and it all stems from this paper I wrote called Not Above the Law. I wrote it with colleagues, you can see here, and the link is here. A legal and ethical analysis of short-term experiences in global health. And this came about because I was asked by these other co-authors who are physicians. Well, Judith is a sociologist. They had been working and thinking about sort of the medical ethical aspects of short-term experiences in global health or medical mission. And they said, look, there seem to be some laws that are being broken here. Can you do and help us work through a legal analysis of these issues? So that's what I want to talk to you today about today. And as a caveat, I would say that I sometimes refer to myself as a recovering voluntourist myself. Like I've been learning as well over the last 10 years. And I have done some things that I look back and think, was that appropriate engagement in other communities? For instance, I went to Malawi and worked closely on a legal brief with some Malawian faculty and law students, and never really considered that I should contact the Malawian Bar Association or sync myself with the local customs around legal practice and legal ethics in that country. So, and in a sense, it was an arrogant move on my part to show up and say, I'm here to help with my legal services and not consider how I fit in with the rules and standards of that country. So I want to come from a humble position when I share this presentation. So just to get everyone on the same page, the way we refer to these medical missions in the article is short-term experiences in global health, and we call them STEGs, which I know is a very ugly acronym, but if you hear me say STEG, it's the short-term experiences in global health. And what I'm talking about here are medical missions, service learning experiences, medical internships or externships, global health field experiences or international electives that take place outside of the US, often in low and middle income countries. These organizations, sometimes they're associated with a university, sometimes they're private organizations. They will place individuals in clinical settings to help or gain medical experiences. And sometimes these groups take over suitcases of medical equipment and supplies and donations. Who are the participants? Well, they can be high school students, undergraduate students, graduate students, like most of you, as well as church group members and licensed professionals. And all of these different groups have different primary reasons for participation. You'll see sort of high school students going to help create something for their resume to move into college, undergraduate students hoping to get into a graduate professional school. And then of course, church group members have different reasons based on their faith for engaging in these medical missions. And this is a picture down here at the bottom right of what you would see as a typical picture from a medical mission. So then what are the ethical concerns with these activities? And I want to say there are groups that do these STAG short-term experiences in global health very well, with the highest attention to ethical details and working closely with community members. I'm just talking about this group of bad actors that don't follow what would be considered best practices, don't work with the community. And the ethical concerns with those groups are what we call these irregular ad hoc pop-up clinics that they sometimes set up and with limited coordination with local health authorities. Think of a sort of, we'll be in your town for 2 weeks and 2 days, and we'll meet in your local church or elementary school. And then treatments are provided or drugs are given. And then when the group leaves, there's limited or no patient follow-up. So the local staff has to deal with any outcomes in that regard. It can create a strain on healthcare personnel and patients in low resource medical settings. And that's typical when you have sort of groups of students appearing in a clinic or a hospital. And I'm sure you've seen pictures of this, sort of observing or taking part in interventions, and having the local health care provider really focused on that visiting student group instead of the patients that have come for care that day and may have traveled quite a long time. And when that much attention is given to a visiting group, you can imagine when that healthcare provider has to catch up on his or her work or meet with his or her patients, you know, late at night after hours it's often in already strained healthcare settings. These groups sometimes put local healthcare providers or systems in a negative light. And you can see that happen when someone in a community will say, I'll wait for the visiting doctor to come. I'll wait for the US healthcare provider to come. And you know, it casts a negative light on the skills and abilities of local healthcare providers. Often these groups do little to work themselves out of a job. And you know what I mean by that. Ideally, attention would, if there is a local a setting where there are healthcare needs or low resources, ideally the need for resources would be identified, and groups would help support training of local healthcare providers so that one day those needs are met without visiting groups. And you don't see that happening because why? This is a big business. A lot of money goes to these organizations. So for instance, I'm going to show you a video clip soon, or send you the link of a group called All Access Med, which sends high school students to Vietnam for 2 weeks, excluding airfare. The cost is $6,000 for the student to participate for 2 weeks. So you can imagine how well that $6,000 could be used in another way to provide training and develop new healthcare providers in a low resource setting. So here are the legal concerns that I focused on in the paper. There's this hands-on clinical participation of volunteers lacking medical training or required licensure. And a lot of these groups, especially when you involve high school, undergraduate, and well, actually all of the STEG categories, there's a lot of hands-on clinical interaction, sometimes because students want to say that they have that clinical background on their application to the next level of schooling they're going for. There's also a lot of importing and dispensing medication contrary to local laws of that country or municipality. We know that given the lack of training and licensure of some of these volunteers, there's medical malpractice happening and medical mistakes and violation of patient privacy. And of course, HIPAA is a US law, but there are related laws in other countries protecting patient privacy. And this selfie of someone in surgery at the bottom is sort of a typical way that you'll see people who participate in some of these medical mission groups posting online. And then you can see the patient's face. It's not appropriate. And however, for this presentation, I'm not going to focus on medical malpractice or violation of patient privacy, just the first two, practicing without a license and importing drugs. Okay, so there's a lot of words, but I just want to give you some examples so you know what I'm talking about. I'm going to read these out loud. Of course, they're under various things on my screen, so I will try the best to read them, but I just want you to see what I'm talking about. So these are experiences that we gathered, learned about as we researched the paper. An undergraduate student travels to Ghana and after observing 2 lumbar puncture procedures is permitted by the physician in charge to perform more than 100 of these procedures on patients over a 6-week time period. A pre-medical student volunteering abroad does not speak or understand the native language of the physicians, other healthcare workers, or patients, yet is permitted to diagnose and write a prescription for a patient. She thinks she has cleared the proper prescription dosage with the local physician. However, the dosage she writes is 100 times stronger than what should have been prescribed. A group of undergraduates on an overseas learning experience is tasked with reading microscopic slides used to diagnose malaria. A couple days later, someone realizes that they are reading the slides incorrectly and have misdiagnosed dozens of patients. A 22-year-old US pre-medical student states during a volunteer experience in a Tanzanian hospital, "I'll be damned if I leave Tanzania and haven't delivered a baby." 2 days later, after a 15-minute lecture by a British midwifery student volunteer, he delivered a baby unsupervised by Tanzanians. So I think, does everyone see that the type of activities that are causing concern with some of these STEG groups? Okay, I don't feel confident enough to show this video to you, but I'm going to put the link in the chat. If you get a chance, I want you to listen to Lewis Does Brain Surgery. Even the title tells you all you need to know, because Lewis is in high school and he goes to Vietnam. And this video is demonstrates in rousing celebratory music his confidence at asking to take part in the surgery and his bravery at being willing to help. And he says in the course of this video, you just have to learn not to say no. And at first, when I started suturing this patient's head, I'm a lawyer, so I'm not saying it well. When I started suturing this wound, it felt very awkward. But after a while, I got the hang of it. And then I was able to close this wound. And so what's most, not just the fact that he engaged in these activities, but that the way they're celebrated, that's very troubling, because it demonstrates this sort of white savior ability that I am here to help. My help is wanted. My help is needed. My help is special. And so this video is very troubling in that regard. And this group, All Access Docs, or Future Docs Abroad, they have several names. They actually state on their website this quote: "Future Docs Abroad does not happen in the United States because of our privacy laws and insurance regulations that restrict high school and undergraduate students being in hospitals." So they're not they know what they're doing, and they're providing other opportunities. So part of my research was to look at clinical interaction with patients without a license or outside a training program beyond the scope of practice, and the importation and distribution of drugs outside the legal framework. And what I found out, which you all know, these are not allowed in the US. You can't clinically interact with a patient without a license or outside of a training program like you students are in, or beyond the scope of your practice. And you can't just bring drugs in from any country and start distributing. We know that's not allowed in the US. I didn't need to have to do research. You don't need to do research to know that. But what our research showed us is, not surprising, that is also not allowed in all the countries we surveyed. And there are laws for that and cover that. And it's the sort of the lack of investigation into what laws apply, which is troubling. So I'm just going to go a little into this issue. So just for all of you to have a little background on licensure in the US, and in every state, people are licensed, and we're talking about licenses for physicians, nurses, dentists, pharmacists. Every state is required, state licensure is required to practice medicine in every state where a healthcare provider practices. So if I'm licensed to practice medicine in Maryland, do I need to be licensed to practice medicine in Virginia? Yes, I need to go through that. I have to be licensed in every state I practice. So what does it mean to practice medicine? And this would be the same for dentistry or pharmacy. It means to engage with or without compensation. So that's volunteering in medical diagnosis, healing, treatment, or surgery. And people ask about students. Well, students aren't licensed, but you know what? It's not that they're not licensed. Medical boards, pharmacy boards, dental boards, no students are interacting with patients, and they allow it because the student's in an accredited program and the student is supervised by a professional licensed in that state. So it's not like students, anything goes. The boards know that students are interacting with patients, but they're in programs and they're supervised. So when we looked at medical licensure overseas, I couldn't survey, I think there's 230 countries now, I don't know. I couldn't survey every country, but I was able through various sources to determine that almost every country has licensing boards similar to the US model. That is, boards that license healthcare providers and discipline them. Even North Korea, I wanted to be able to say every country. I looked into North Korea, and it turns out you cannot haul up in North Korea and say, I'm here to perform eye surgery or what have you. You need to register with the North Korean Board of Healthcare Providers. In all these countries we surveyed, the penalties are similar to the US, which involve all the way from fines to limitations on practice to criminal sanctions. And of course, in some countries, especially the low resource countries, there's low enforcement of these medical licensure rules. And I'm sure you can guess why that is. And it's because the members of the board are heavily stressed. They have day jobs, they have other jobs, and they just don't have the resources to engage in enforcement. But that doesn't mean that those laws aren't in place and that those laws aren't important. So are there any questions so far? I see there's some chat. I'm just going to check to see if there's anything that I need to attend to, like you can't hear me or anything. No, it seems like okay. Anyone have any questions right now before I go forward? Okay, just I can't see everyone because you're just in a little line, but you can burst out if you want to ask a question. Sorry. Okay, so someone just came into the waiting room. Let me admit them. So then how can you engage in medical care in other countries in a way that is ethical and is appropriate and does follow the law? And one thing is most countries, every country we checked offers temporary licensure for visitors, visiting physicians, but also for visiting dentists and nurses and other healthcare providers. So I just wanted you to see what it says in Kenya, just as an example. Any practitioner not registered in the Republic but who, having valid qualifications from a different country and who is desirous of giving medical or dental services in the course of any humanitarian or other valid cause, shall be required to obtain a license upon payment of the prescribed fees, subject to a maximum period of 12 months. So this is what these laws look like, and there's a process to engage in them. So when part of our paper was to survey people who didn't get a local license in the country where they went on a medical mission, and these are the most common responses we got. Well, my US license works over there. That's not true. That's just not true unless you've gone through the medical board process in that country. Just as you wouldn't expect a Tanzanian medical license to work in Baltimore or in the US license doesn't, Maryland license to practice medicine doesn't work in Tanzania. And that's not a secret. Right on the State Department website, you'll see that most countries will not accept a US medical license outright, and there's a process to get medical licensure in the host country. Other people say the sending organization is taking care of this for me, like this group that is organizing this trip to this other country is taking care of it for me. You will know if they're taking care of it for you because you'll have to submit a lot of documentation about your licensure in this country, your training, what you're going to do. So unless you've submitted all of that, you can be pretty sure that the sending organization isn't and can't take care of it for you. So that's not a valid reason. So the hospital administration or clinic where I'm going to in another country says it's okay. And I believe this happens a lot, that the local administrator of the hospital, for instance, where Lewis did brain surgery, it's like, no, it's fine. You're good, no problem. But that's not enough. Just like if you walked into a clinic here in the US and your friend or colleague who's a doctor said, you can come and observe or touch this patient, it's no problem. You would just know that wasn't right. Like that there were rules within the hospital or the country that you had to obey. And so the American Association of Medical Colleges acknowledges this in their guidance around students doing this and says, even if a local health care provider is supervising your interactions with patients or says that it is acceptable for you to perform a procedure, violation of local laws may still be a punishable offense. Some say it's too burdensome to get a license. I'm just going for 10 days. Again, that wouldn't be a good excuse for someone visiting here. And I'm admitted to the Maryland bar. I don't have a medical license, but any of you who do on this call, I'm sure you'll give a thumbs up to say it's burdensome to get a license here too. And that's just part of protecting patients. I mean, there are other reasons boards exist, and it's a little bit of protection of the profession. We're not going to get into that, but a big part of boards is protecting patients, and therefore they require a lot of information and understanding of what someone's qualifications are before providing a license. So it shouldn't be surprising that it's often difficult in another country as well. And we already went through this. Medical licensed students don't need licensure in the US, so we don't need it in a host country. Again, medical students or other health science students don't have a license in the US, but they're practicing under a framework of guidance. And that is often the case in other countries, that there are special rules for students and how a student can interact with a patient that involves supervision and accreditation. So moving beyond licensure to drug practices, here are things that are generally not allowed in most countries with slight variations. It's often not allowed to import drugs into the country without proper permissions. You can't distribute drugs without an appropriate medical license. You can't distribute donated or expired drugs. You definitely can't do that in the US outside of there is a donation framework, very strict. And you can't distribute misbranded or adulterated drugs. And what those words misbranded or adulterated often have to do with the labeling and the packaging. So repackaging drugs in Ziploc bags, that would be misbranding or adulterating, or not including specific instructions, or including instructions in a different language. Those are all things that you can't do when you distribute drugs. So these things with arrows are illegal in the US, and they're illegal in 30 countries we surveyed around drug practices. The World Health Organization, as far back as 2011, already noticed that this was a problem, and put out this guidance that's been around for 10 years now, which clearly says donation of medicine should be based on an expressed need of the community and made via prearranged coordination. And what they're saying there is, just don't show up with what you had available to give out. We may have needs, but ask us what those needs are and coordinate with us, because it happens sometimes that when there are limited drug supplies in a country, if a big amount of supply shows up in one place, the central drugstore can stop delivery of that supply. So there needs to be important coordination in that regard. That's what the pre-coordination is for. Distribution should be given in conformity with the government policies of the recipient country. And there should be no double standard in quality. If the quality of an item is unacceptable in the donor country, it is also unacceptable as a donation. And so that's an important statement right there from the World Health Organization. I'm going to look at the time quickly. So what are solutions? But before I go to solutions, does anyone have any questions? Not yet. Okay, you can put some questions in the chat if you want. So it's not good to uncover problems or issues without thinking about potential solutions. One, anytime there's a problem, people say there should be a law. The law is where people go when ethical internal guidance or organizational guidance isn't enough, and what you go from sort of the carrot to the stick of the law. And I don't know if we have any law students here today, but one thing you learn in the first year of law school is this presumption against extraterritoriality. And this essentially is saying that US law applies in the US. When you're outside of the US, that country's law applies. And we know there's, embassies have some type of exception from that, but for the most part, this is the case. And so what this presumption says is, absent clearly expressed congressional intent to the contrary, US laws will be construed to have only domestic application. And, we want that. That's how countries preserve their sovereignty, that our law applies here and other countries' law applies in that country. That's as it should be for the most part. And it's been challenged in the cases of big environmental disasters or human rights disasters, but it's not really challenged on small individual cases. And we know that these acts, potential medical malpractice, practicing without a licensure, Congress isn't going to make a particular act around those to let US law apply. So we're really depending on local law to deal with those infractions. And that is why one of the biggest areas of solutions is to support criminal and civil litigation in host countries where these acts are taking place. I wonder if any of you have heard of the Renee Bach case. So here is Renee Bach, who was a very young American missionary. I think she went over to Uganda when she was 18. And she, was struck by a situation of malnourishment of children in a specific area of Uganda, but with no medical training at all. She opened a treatment center for malnourished children, and she didn't have any medical training. And what was difficult and sad in that situation is within Uganda, there's a system of referral hospitals. So you essentially have a network of smaller clinics that are referred into bigger specialty hospitals. And her clinic actually held back that referral process and kept those children for treatment. And at least 105 children died in her center. And some obviously probably did arrive in quite a despairing medical situation, but that wasn't her decision to make, and there was a process for referral within the country. And so with the support of local human rights lawyers and some financial support from outside Uganda, this was one of the first cases brought for litigation within Uganda. And the lawsuit was brought in the civil court by two of the women who, mothers of babies who died. And it actually resolved in a settlement for these two mothers. So under an agreement reached, this is July now, 2019, Bach and the charity serving his children paid $9,500 to the two mothers, but didn't make an admission of liability. What's interesting is that she asserted that she was not practicing medicine, and that she had just set up this clinic, and she had erased, scrubbed all her social media and Facebook and whatnot of any pictures, but there's some mechanism that someone did some forensic stuff and found this picture. And this picture was the linchpin in the case, because this clearly would fit in the definition of practicing medicine, right? Like, she has her gloves on, looks like she's inserting something into this baby's head. So this picture alone forced her to settle, in a sense, because it was obvious she was practicing medicine. So beyond supporting these cases in other countries, education is probably the biggest way to go in terms of stopping these practices. And I noticed that students nowadays really get this. And, you know, just like I went to Malawi and sort of practiced law without a license, as soon as someone talks to you about how wrong that is and the presumptions behind that, it's not hard to realize what's wrong and correct your behavior. But is someone there who maybe isn't muted? Is everyone muted who's on the call? Just so that we can have. Right. Lauren, if you can see who's unmuted, you want to ask them to mute?
Everybody should be on mute, but they should be able to unmute themselves.
Okay. Anyway, I don't know. Okay. It's not too bad. So there's a sort of, in terms of education, one rule of thumb is just, that's all you need to know. If you can't do it here, you can't do it there. That's the easiest way to think about it. If you're not allowed to do it in the US or in your state, you can't do it, the medical treatment, interaction, dental intervention anywhere else. Another part of the educational campaign is this brochure declaration. And I want to tell you that University of Maryland, Baltimore is a signatory of this, and it basically outlines what our values are in this regard. And in the final statement in that declaration is, we, the undersigned, call on the international community to make every effort to maximize the value and minimize the harm of short-term engagements in global health. And this is more and more universities and organizations are signing on to this declaration. Also, we are this group, like a group of authors I was with and other people, are working with the Association of Medical Regulatory Authorities. This is the board of boards, like an international organization of medical boards, to support licensing boards in these host countries to do enforcement, to do education. We're also, this is really interesting, we're working with US licensing boards. We've reached out to different boards and different professions, and they do not like to hear about this, because I think they feel almost like a fellow feeling with these boards in other countries. And when they hear about how people are showing up in these countries and municipalities and practicing medicine without consulting the board, they feel how that would feel if people showed up here and refused to understand or obey local laws. But they thought about, can we ask people when they apply for a medical or pharmacy, whatever license, or when they go to renew their license, can we ask them if they did any of the activities? And if they say yes, can we punish them or refuse a license? And that actually seemed very difficult to do, because a license to practice is considered property in the US. And you can't deny someone property without due process, and that would involve investigating a case in another country. a lot of investigation that is going to cost money and be very difficult to make a case. But they thought, and this is still an ongoing process, that they could ask the question of future and current licensees, have you ever engaged in the unlicensed practice of medicine in another country? And if the person says yes, have them undergo an education module or have to watch a video about why that might be problematic in order to get the license. But that's an ongoing process. And we also want to limit the incentives for students to engage in this illegal practice. In other words, a lot of medical school admissions committees like to see clinical experience of their applicants, and that actually can cause students to have to find a way to do this. And so I'm not part of this group, but there's a working group that's working with admissions committees to find other ways to get the information and demonstration of experience that they need without almost forcing students to engage, find opportunities for clinical experience. And so I am going to close with two slides. One is just, the bigger picture is really reflecting deeply on motivations to engage in overseas medical missions and what type of colonial history or colonial backdrop to these practices needs to be reckoned with. And so I want to show you this young man who was arrested for pretending to be a doctor in West Palm Beach. And everyone was aghast that he would attempt to see patients and set up a shop. I mean, I'm not sure who went to this young man, but he did see some patients, and he was arrested. And the sheriff of West Palm Beach said, just because you saw a season of Grey's Anatomy doesn't mean you could practice medicine. And it was just ridiculous that he would do that. And then you think to the contrary of Lewis, the fellow who did brain surgery in Vietnam, being so proud and, having this music play in the background that he's helping this poor country in their medical system. And that's very telling, the difference between these two scenarios, right? So finally, this quote, and I'm going to close with this, and then I have a colleague, I think she's on the line, who might offer some other comments, is he's a law professor, my mentor. He wrote in an article, one has to ask, why would someone from the US, who by any metric would be considered a good and law-abiding citizen, travel to a foreign country and engage in activities that they know or should know are illegal in the US without asking if they were also unlawful in the country in which they volunteer? What tsunami of cultural, academic, and economic forces not only supports volunteers in such behavior, but encourages and even celebrates it? I believe it is a vestige of an outdated model of charity that distorts the value and potential of the vital field of global health. And I think he summed it up very well in having us really reflect on these practices. So thank you for your attention. I am just going to stop sharing. I actually don't see my colleague, Nadia Samagudu, was going to join. She's a physician in Ghana and Nigeria. I don't see her, that she made it, but I'll stop there and open it up for any questions that you may have. Or comments or thoughts.
I just want to thank you. It was very thorough and just informative. I'm a pharmacy grad student, and I'm not in the medical field per se. I'm aware of a lot of these charity organizations who go abroad and do these things, and I guess assume that they were doing it in the right way. It's devastatingly horrible to hear this. And I do see this ongoing colonialization and like unethical treatment and devaluing of other diverse cultures as very thematic in this. And you did touch on that, and I do recognize that and see that in this global leadership pathway theme. And thank you for the education. Thank you.
Thanks, Karen. I do think it is part of a bigger theme of colonization. It's a little piece of it, but it is reflective of the attitudes that a lot now people are thinking of how to reverse some of those attitudes that have been so destructive, and really think about important mutually beneficial relationships, because we also know we have so much to learn, and COVID really laid that bare, didn't it? That the US has to be a humble learner too. Sarah, were you going to make a comment?
Yeah, hi. Are you able to hear me all right?
Yes, we can. Yes.
Okay, cool. First of all, thank you so much. I really appreciated the talk, and I found it just to be very interesting, but also practical. I had two questions. One was, I was just curious in your research if you found any organizations that do it well, that are sort of an example of, I was just curious with, like, I don't know if you know anything about like Doctors Without Borders, or those ones that do sort of longer term missions and stuff, and are very global and reactive and sending people in very like quick situations, I guess. I was curious if
thank you so much. And that's a really good question, and I should have followed up, and I can follow up with this people in this track. There are some good organizations, more and more every day. And one is Child Family Health International. That's one, CFHI, Child Family Health International. The woman who runs that was one of my co-authors, and she's made a very important contribution by re-envisioning what a STEG, a short-term experience in global health, can be, by exposing people to public health practices and learning from others and observing and focusing on being the humble learner and things like that. So CFHI is one. Doctors Without Borders is a great group. For the most part, they always focus on the licensure. And when it's an emergency, sometimes there's not enough time, but they're always submit the names of people and credentials to medical boards. They try to do it in advance. So that's good, but there are more. Those are the two you mentioned, Doctors Without Borders, but CFHI is one, but please reach out to me. There are others, and there are also others within specific professions too.
Great, thank you. The other thing I was just going to ask quickly was with medical students, I guess, because in the US they have to be under the supervision and in an accredited institution. I know that there are like global electives, I guess, through the medical school where they go and you're still supervised by somebody that's accredited under the US. Like they have their boards and everything in the US done. I don't know. I assume that they have whatever set up on their end too, but our students, I guess, like, is there a legal pathway for students to do that in another country? Do you still have to apply for something, or how does that work?
Well, if you're doing it, for instance, through our medical school at UMB or through other medical schools, well, definitely our medical school, and I would say most others, focus on making sure there's an affiliation agreement where all of these things are spelled out. And the most important thing is that if there are different rules in another country, that there's an understanding of what they are, so that anyone entering medical student, for instance, knows what they can and can't do, who's going to supervise, what level of supervision is required. In some countries, there's different supervision of medical students than is allowed in the United States, but as long as that's all understood and agreed, that's okay. So the answer is yes. A good medical externship for a student is one where the two universities have a memorandum of understanding of what's allowed, and that everyone's working within those parameters.
Okay, thank you so much.
Anyone else have any questions?
All right, I don't have a question. I just wanted to say thank you. I joined this session because of the President Student Leadership Institute. It was one of the sessions from the track. And I find this session very interesting, and I'm happy that it's happening because I used to work in the study abroad space, and mostly with students who were undergraduates. And I think I wrote in the chat how confused I always was when students would come forward hoping to do some of the things that you presented as examples as malpractice in this discussion. And I think that it's internal, right? Understanding what is right and what is wrong, and holding the organizations that you choose to go abroad with accountable, right? With regard to asking the questions of what is it that you have in place and what actually will I be doing? Because the last organization that I worked with, we were very clear about one, cross-cultural communication and understanding the actual service that was happening, and taking a space of humility, right? And thinking that I'm not going there to just necessarily save people. I'm going to listen and then figure out how they would like to have me be of service. And I think that you talked about that beautifully. So thank you.
Thank you, Candace, so much. Which school are you in now?
Yeah, so I'm actually a social work student, focusing on being a clinical therapist, but I'm absolutely interested in health, mainly public health. And, I think that even with regard to that, being cognizant of the type of information that you're giving out with regard to, again, cultural humility, thinking about, the backgrounds of the community that you're serving, and going and listening as opposed to saying, I'm going in to save because it feels good. And I'm also a former expat, so in many different countries in Asia and so on and so forth. So yeah, I just think
Yeah,
that
I just ask because I'd love to talk more and be in touch, because I think once you hear a presentation like this and really think about it, it does cause, it becomes obvious why it's so wrong. And I would love to have more student representatives sort of understand and share that message. And especially because you have experience in education abroad. So you see that there's a lot of interest in this, a lot of push to make it happen. And sometimes it's hard to just, say, think about this a little. So I'd love to be in touch sometime.
Yeah, sure.
Any other thoughts or comments? Michelle.
Hi, Virginia. I apologize if I have a lot of background music. So, but a couple of years ago, I participated in a Tanzanian trip with International Medical Relief, IMR, and I was curious if you were familiar with that organization. I thought it was very well run. And it appeared that they were extremely legal, and if I ever had to or wanted to do another one, I would choose them again. And I was just kind of curious if you had any experience with that organization.
I don't, but thank you for sharing that, and I'll look them up, because we are always asked about groups that do good work, and especially, which school are you with now?
So I'm with Karen in the pharmacy school. So, and I always I really want to get into international work a little bit more. I'm also a chiropractor, so I'm licensed, and so I had to submit all of my licensing credentials and all of that stuff. So that made me feel better too. But
well, thank you for that. Pharmacy students tend to be very active in seeking international experiences. So I appreciate that. I haven't heard of that group, but thank you. And as we sort of, I have a goal of creating a roster, I might want to reach out to you and ask you more. Thank you, Candace, for your email. I'm noting it down. Anyone else?
Will you be sharing your slides?
I will, happy to. I think Lauren Taylor from our office is on this call. We can definitely send them to everyone who registered, but there's probably PSLI, this whole institute probably saves them, but in any case, you'll have access. I'll email it to you.
Great, thank you.
Well, if that's all, just great to have this conversation with all of you, and just be ambassadors for this message. And I think UMB definitely is a good place in regards to this, and lots of faculty members and students think the same way. So But I'm really glad you joined, and you know where to find me. I'm at the Center for Global Engagement. And if anything comes up that you have a question or you want to meet and chat, I'm happy to do that. That's what we're there for. So with that, then have a great rest of your day, and hope to see you soon. Take care.
Thank you.